Welcome to our awareness series today, Love Your Heart. My name is Andrea Watkins, and I am so happy to have you guys here. To continue our awareness series today, we're going to talk about the importance of CPR. But before I get to that, I wanted to go ahead and talk a little bit about the Women's Fund. So we are a nonprofit dedicated to providing Greater Houston females with the tools that they need to be advocates for their health. We do this by providing free seminars like the one that you're in today. And we also do this by giving out free publications. If you see the QR code on your screen, if you just kind of want to wave your camera over it, that'll take you directly to our website where you can download these publications free of charge. If you have a bigger organization and you want to maybe just get a couple hundred, or maybe you have like a doctor's office or anything, or a church, you can also request publications, again, free of charge. You would just have to fill out a quick form. So thank you again for tuning in. We know that this is some precious time that's taken away from you, but we really appreciate you tuning in today. So we're going to do things a little bit different today. We do have a guest speaker, Marlene Watkins, which we are so happy to have, but we're going to do kind of a co-host situation where I kind of dive deep into the history of CPR, because CPR is more of an in-person instruction-based class. It's kind of difficult to find content without being in the class. So what I did is I went ahead and I found some history about it. So we're going to do a little bit of that, and then I'll give it over to Marlene so she can give us, some more facts and kind of have it like a co-host. Okay. So before I get started, you guys know me, I typically do presentations for the Women's Fund because I work for them. But Marlene is a certified American Heart Association CPR instructor that owns her own business named Lake Houston CPR. She has been training potential lifesavers for over 16 years all throughout the Greater Houston area. On top of individual certifications, she collaborates with businesses, schools, churches, and other organizations to provide CPR certifications. She is passionate about her role and continues to educate people over the importance of being a lifesaver. All right, so with that being said, I'm going to go ahead and dive into the history. I'm also going to stop my camera just so that there are no issues with my Wi-Fi, that it can just cling on to my voice. But I'll come right back. So it was very interesting to learn how CPR came to be what it is. Just like anything, and just like any new science, with time, everything gets better and better. So what I saw, or everything that I've gotten today everything that's on this presentation is from the American Heart Association, almost every single thing, but it's pretty interesting, all the history that's behind CPR. So in the 1500s, they used what's called the bellows method, which I thought was very interesting. It's this instrument that you put in your mouth, and it actually was used to stop fires, which I thought was very interesting. That's how they used to give breaths, per se. This method, of course, had its faults, but it was used over 300 years as the primary resuscitation method. The key problem was that it had the few people, nobody would be carrying this thing. So it was kind of hard to just pull this thing out and then try to give someone proper breaths. So doctors also had a much lesser understanding at that time about the human respiratory system. So they didn't realize that the neck of the patient needed to be held back to open the airways. And so that minimized the life-saving effects on it. Let's see. So 1732, that was the first indication of a doctor using mouth-to-mouth breaths. But he actually didn't write this down or log it much later, actually. And it was in Scotland. He used mouth-to-mouth to give breaths to a suffocated coal pit miner. And he documented this 12 years later. So it was actually in 1720. And then in 1740, it officially got recommended that you use mouth to mouth for reviving victims that have drowned. And then in this chunk from 1774 to 1782, the Royal Humane Society was created and shocks were discovered. In doing this research, a lot of these things came from Europe. A lot of these discoveries came from also experimenting with animals. So the whole shock came from a chicken. This Danish doctor, he rendered a chicken that was lifeless by giving it shock and found out that it could restore the heartbeat, which I thought was very interesting. So this is how they used that method to give breath to breath before we discovered mouth to mouth. And if at any point you guys have any questions, please feel free to put them in the chat. Okay, so then we have, again, as time went on, as science goes on, you get to see, doctors get to discover, well, you know what, that's not really working, or how can we tweak this to make it work better? So in 1856, the Hall method is introduced. And then in 1858, the Sylvester method is introduced. So again, these were both London physicians, and they kind of just altered the technique, repositioning the patient from face up to the side, and then the Hall method approached it by adding pressure to the thorax. And then with the Sylvester method, they created chest pressure by lifting the arm, and then the patient's arms expand to the chest, and then they cross the arms over the chest to apply pressure. Again, these are all things that were not discovered here, but over in Europe. And so then we fast forward to the 1900s, and this is when actually the American Heart Association was discovered in the 1920s. So in 1903, before this, they gave external chest compressions to restore circulation in dogs. So again, it went from chickens to dogs, and then there were also cats that were given this experiment to see if it worked. And then this was another indication in Ohio in 1957 that a doctor performed mouth-to-mouth resuscitation. I don't know why I can't say that word. And it's documented and it was proven that this worked. And this nifty little thing was discovered in 1957, and you probably don't even know what it is because it doesn't look anything like a defibrillator, but it was the first portable external defibrillator that was invented by a team of doctors at Johns Hopkins. It actually weighed 200 pounds. So now we went from taking the fire starter thing to having a 200-pound contraption, which I just don't think that's very portable. And then in 1960, I've seen a lot of Anns in my life because my mother-in-law has a lot of CPR models. So Ann is a common name, but you can see the evolution from 1960 to current day, what Ann looks like. These are CPR mannequins that were developed so that people can train on them. And then in the 1990s, there was public access defibrillation programs that are now available. You probably will talk a little bit more about AEDs, but it wasn't until the 1990s that this was something that was a public health announcement. Now, I did a lot of skipping with history, but these are pretty much the bigger points. If you have any questions about anything else in particular, please feel free to help us or to ask us questions. And then in 2008, which I'm sure Marlene will go into it, and the recommendations changed. Again, as science advances and medication and things, we get to make adjustments to what we've learned. It changed over time. And then in 2013, there were CPR kiosks in airports. And the first one was actually in Texas. It was in the Dallas airport. And now there are over, I believe, 200 across the country. So what was the whole point of me telling you the history? It's because it's miraculous how far we have come. This was called the inversion method. Can you imagine if you were, if your heart stopped, you had to pick someone up, find a rope, and then put them over like something very heavy, like a tree branch? Yeah, this is actually what they used to use as a CPR method. They also used to, it's the Dalry-Mopple method. I'm really not sure if that's what it is, but yeah, they would just kind of whip it out of you. Or they would take, I think this is the Dalry method. They would take this big old, couldn't even call it a string, or a sheet, something, and they would try to take that pressure around you. And they also used to have a barrel method where they would put you over a barrel and try to get it out of you, or like a choking method, or a give blood to the heart method. I also saw someone put them over a horse at one point. So the interesting thing about history is that now we have come to see what the proper CPR techniques are. Okay, so we have a quick video, and I believe the audio works. If it doesn't, just let me know in the chat.
Let me tell you something. I want to give you something to think about.
Sorry, make sure the sound's completely on.
It's a number, a big number, about 475,000. 475,000 isn't just a number, it's people. People who died from cardiac arrest in 1 year in the United States. Big number, bigger opportunity. Because we can get that number down to zero. We can save all those lives. We can create a world where no one dies from cardiac arrest. Am I dreaming? No, I'm not a dreamer. I'm a visionary. And I'm asking you to be too. I want you to see it first, that world, and then do your part to make it happen. I need you to believe in your heart that it is possible. And then focus all you do, help focus all we do on that goal, on saving every single one of those people. Because we can do it. It is within our reach. How do we get there? You know how we get there. We'll create systems that automatically detect cardiac arrest and activate an emergency response. We'll mobilize an army of trained and prepared responders to provide immediate CPR and defibrillation. This means pairing 911 response with bystanders through mobile technology, ensuring public access to AEDs, and more training through schools and kiosks. We'll remove barriers to getting bystanders engaged, creating tri-standers in the general public. We'll eliminate preventable cardiac arrest in hospitals using monitoring for early detection and rapid response teams that will stabilize patients immediately. We'll make sure all healthcare providers deliver high-quality CPR with innovative quality improvement tools and sessions. And finally, we'll personalize resuscitation to each patient, leveraging the latest technology to identify and treat underlying causes. To get that 475,000 down to zero, it starts with you right now. You're doing good work. We do good work. That has laid the groundwork for us to be truly extraordinary. Believe in the vision. Let it drive everything you do each day. Let it rise up in you like a shout, joining the voices of your colleagues, teammates, neighbors, and family. And then look around. See that number start to decline, life by precious life, bit by bit, until that one glorious day when everyone who would have died before all this work instead wakes up groggy and thankful in a hospital to greet his or her family, and we arrive gloriously at zero. Because of you, because of our vision, a world where no one dies from cardiac arrest. Let's get started.
All right, so I am going to turn it over to Marlene to talk a little bit more about heart attack and cardiac arrest.
Okay, so sudden cardiac arrest and heart attack, some people often use these terms to mean the same thing, but they're not. So we'll talk about a little bit about both. Sudden cardiac arrest results from abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so that it can no longer pump blood to the brain, lungs, or other organs. So, but within seconds, the person becomes unresponsive and is not breathing or is only gasping. And then death can occur within minutes if the victim does not receive immediate immediate life-saving treatment. So that's what that is. And then the heart attack occurs when blood flow to the heart muscle is blocked by a clot. It typically, during the heart attack, the heart continues to pump blood, but it just can't pump as much. So that's really what, the difference is between both.
Awesome. So let me continue sharing. All right, so I'll give you some facts and stats about CPR, just so we can see, what the numbers are. So in the workplace, there are about 10,000 cardiac arrests in the workplace each year in the US. That's a lot, right? So are we equipped with how we can, help this person? It says that among a study of 2,000 employees, 55% can't get proper training from their employer. This is not something, we usually go through a bunch of things in the beginning when we get this position. We go through trainings and seminars, but CPR isn't actually something that is required for every job. If training is available, it is often one or the other. So what that means is it is often CPR or first aid, which are two separate classes, but they're not both. So they don't get both classes. And then half of all US workers cannot even locate an AED in their building. I'm not really quite sure if it's a state mandated law. I believe it is. Again, I'm not really sure, but they're supposed to, I know in schools for a fact, they're supposed to be AEDs and in airports. But if something were to happen right now, most employees cannot locate where it is. And then 66% of employees in a hospitality industry cannot locate an AED. So I know sometimes we feel like, oh, well, we don't really interact with customers or clients, or, in our office, it's just us. But that just us, one of your fellow coworkers, something can happen to them. So it is vital to know all these first aid skills and these CPR skills. All right, so like the video said, in 1 year alone, 475,000 Americans die from cardiac arrest. More than 350,000 cardiac arrests occur outside of the hospital. So that's pretty terrifying. Only 46% of people who experience an out-of-hospital cardiac arrest get the immediate help that they need before professional help arrives. And that 90% of people who suffer cardiac arrest die prior to reaching the hospital or a medical care facility. So, when something happens, it's not just you call 911 and you just stare at the person. Like, I know it's a moment of panic and it's a moment of where you don't know what to do, but having these proper skills and taking note of the time, because time is very precious once you call for help, for professional help. All right, and then less than 20% of Americans are equipped to perform CPR during a medical emergency situation. Effective CPR provided by a bystander in the first few minutes of cardiac arrest can increase the chances of survival by 2 or 3 times, right? So it is very important to at least get some maneuver, some way of doing it. It's better to attempt something than to attempt nothing. And then if a bystander does not perform CPR, the survival chances will decrease 7% in every minute of delay. Okay, so if you administer bystander CPR, you risk being sued. This is a myth, regardless of what happens. Let's debunk this myth. So there is a thing called as a Good Samaritan law, and that is designed to provide legal support to individuals who administer CPR or first aid or use an AED. This Good Samaritan law provides legal protection to those who help who are injured or in danger. So again, if something happens and you're like, well, I don't want to do anything because I'm afraid that this person will die or that I will, make it worse. You're afraid that maybe there will be some lawsuits after that. You are protected under the Good Samaritan law. So that is a myth. The best CPR training classes are available online. This is another myth because it really has to be hands-on. You really have to see and get the rhythm and get hands-on training. Now you can watch videos and they are available, but actually practicing on a mannequin and going through the notions and getting the proper timing down is important. Another myth is that CPR classes won't prepare you to deal with the real world emergencies. Of course, this is another myth. When life-threatening emergencies happen, it can be difficult. But fortunately, CPR classes are available to help, students gain that confidence. Sure, at the time that you're taking the class, it's not as time, the emergency isn't happening in front of you, but the more you train and the more you practice, the better you'll be able to handle and keep your cool when that emergency does happen. Another myth is that you can contract HIV/AIDS if you perform CPR on an HIV positive individual. No. So I know that, let's say it's a stranger or your coworker, a student, someone falls and mouth to mouth is something that you're just like, ugh, I don't know this person. It's not very COVID friendly to be, doing this. But another concern that you may have is, what if they have something and I contract it? So you cannot contract HIV or AIDS if you give mouth to mouth to an HIV positive individual. The way that goes is through other fluids. It's not through saliva, it's through blood, breast milk, rectal fluids. It has nothing to do with saliva. So don't be afraid that you'll contract it because you're giving this person mouth to mouth. And then again, HIV is not transmitted through hugging or shaking or, through the air. You will not get anything by trying to help this person live. Okay. And then CPR works at all times. This is a myth. You're increasing the chances of this person to survive. If the person does end up, passing, or now the emergency personnel now takes over and something happens, you've at least increased their chances of survival. So don't think that, you're going to save everybody's life. Sometimes it doesn't work. It could be something else. So don't think that, oh, I gave CPR and now, it's my fault that they passed. No, it doesn't work at all times. This isn't a movie. So that's something just to keep in mind. All right, so I'll give it over to Marlene so she can talk more about, how to administer basic CPR or some things to keep in mind when an emergency happens.
Okay. So basic CPR, so these are brand new guidelines, that we're using, but they're really the same basically as they were 5 years ago. We're doing 30 chest compressions and we're giving 2 breaths. So we do give breaths. That's high quality CPRs. We're always going to try to train you to give breaths. If you don't want to give breaths, you could just do hands only. So, but that is our basic compression to ventilation ratio, 30 chest compressions to 2 breaths. And the depth of the chest compression, that's about 2 inches, which is really kind of hard to guess, but they would prefer that you would go deeper than not deep enough. And that's where some people are worried about injuring somebody, but injury is unlikely. Even if you did injure them, you were covered under the Good Samaritan law that you talked about. So but that really is the basic steps to it, and some people, are still scared to do it though, but anything you do is better than doing nothing at all. So even if you're not really sure what to do, when you call 911, they'll always help you and give you instructions if you don't know what you're doing, or you can't remember whatever you learned, however long ago it was. But calling 911 is the first thing that you're going to do. And then they'll help you in giving life-saving. They'll give you the techniques of CPR if you can't remember what they were. A lot of people want to know how long they need to do it. And you're going to do it until this guy has signs of life, until help arrives, or until you physically can't keep going. So, we're not going to tell you exactly, how long to do it. Do it as long as you possibly can. But, you'll have your adrenaline going, so you'll be able to go a lot longer than you think you can. And even if it's a child, you're still doing the same compression to ventilation ratio. Even an infant, it's still 30 chest compressions to 2 breaths. And you definitely want to get them off of the bed or off of the sofa onto the firm surface of the floor. It'll be easier for you to do compressions. It's going to be more effective. It's going to be a lot easier than being on a soft surface. So try to drag them to the floor if you can. We can talk about signs of a heart attack. Some people are not really sure, but the typical signs of a heart attack is chest discomfort. It can last for more than a few minutes, and goes away and then comes back. It can feel like an uncomfortable pressure or squeezing or fullness, or pain. The discomfort can also be in other areas of the upper body. The symptoms can include pain or discomfort in one or both arms, or the back, your neck or jaw, or even your stomach. Other signs are shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or lightheadedness. And then another thing is that women, the elderly, and people with diabetes are more likely to have less typical signs of a heart attack. These signs, include an ache in the chest, or just may feel like heartburn or indigestion. An uncomfortable feeling in the back, there we go again with the jaw or the neck or the shoulder. They can have shortness of breath, or nausea or vomiting. So that's some things to think about, whenever you're trying to figure out what the typical signs, of a heart attack are like.
So we're going to go ahead and play a quick video, and then we will open it up for some questions and answers. Let me share my screen. Hopefully, okay, cool.
There are moments in life we wish we could freeze in time. We live them. We live for them. They are intimately personal. They are gladly shared. What is life if we cannot experience these moments of joy, wonder, and happiness? We want people to experience more of life's precious moments. To do that, we must be healthy in heart and mind. For the heart is where life's moments are felt most, and the mind is where these moments become memories and are relived again and again. It's why we've made better heart and brain health our mission, and together we've made an extraordinary impact. Healthier adults, more active children, stronger survivors. But we are just beginning. Until there's a world free of heart disease and stroke,
We'll be there, making a healthier, longer life possible for everyone. You may ask, why do we do what we do? The answer is simple. Because we are the American Heart Association and the American Stroke Association. And life is why.
All right. Let me stop my share.
Okay, that was a wonderful presentation, very informative. It was interesting to hear about the history of CPR. It's never anything that really crossed my mind to look up on my own. So it's kind of crazy to think of the things that we used to do. And it makes me wonder, like down the line, if people are going to be looking back at our methods and what they're going to think about what we're doing now. But that's just me. So we're going to open up the floor for any questions that you may have. We are a smaller group, so if you feel more comfortable unmuting yourself to ask your questions, you're more than welcome to do that. Or if you would like to just place them in the chat, that is okay as well. I'm going to go ahead and kick us off with the first question. So what is the most important thing about administering CPR?
Well, it's important to not get too nervous, but you know, it's hard to not do that. So to keep calm, keeping calm is going to be what you need to do, and then and calling 911. So you've got to call 911, and then if you forgot anything, they'll be able to help you. So it's really important for you to stay calm and call 911 if you don't know what to do. You're going to call 911 even if you do know what to do.
That's very reassuring, knowing that you can ask someone to walk you through that, because I'm sure that if you are ever put in that situation, it's definitely something that's scary. So remembering to stay calm and work through that. So question number 2 here. With an infant, don't you use fingers for the compressions?
You're correct. You do. You use the 2 fingers, and the depth of the chest compression on the infant is about 1.5 inches, or 1/3 the depth of the chest. But, you know, deeper is better than not deep enough. And it's still 30, but you're right. Just 2 fingers. You're correct.
So you talked a little bit earlier about when you should stop CPR. Some people ask, you know, well, when is a good time to stop? I guess another question on the other end is, when is a good time to start?
Okay, so this person that you found, you're checking for responsiveness by tapping and shouting at them, and you're just looking to see if there's any signs of breathing or any movement. And at that point, when nothing happens, that's whenever you're going to call your 911, and you can put the phone right by them and speakerphone, and you're going to go ahead and start doing chest compressions. So pretty quickly, and it's better for you to do it on somebody that doesn't need it than to not do it on somebody that does.
Okay, that's good to know. Better safe than sorry there. And then going off of that, you know, you expressed that a lot of people are kind of hesitant because maybe they're nervous that they're going to mess something up or do something wrong. Are there certain things that you can look for to make sure that, you know, what you're doing or the CPR is working? Are there certain signs you can look for?
That's very difficult to tell. When you're doing a CPR, we're doing compressions and breaths. You can certainly tell when the breaths are effective, because out of the corner of your eye, you'll see the chest rise and fall. That's really the only thing that you can see. So you don't know when you're doing it if you're helping, but it's just good to feel like you're doing something good for somebody. But you're right, you can't really tell that you are, but just keep doing it and feeling that you're doing the right thing.
Okay, thank you. So you mentioned earlier it's best to have the person on a flat, hard surface like the floor or the ground. Can you talk a little bit more about the head tilt for whenever you're doing the breaths?
Sure. Yeah, you've got to tilt the head back on the person to be able to give the breaths. If you don't tilt the head back and you're trying to give them breaths, it won't go in. So the tongue falls back and it actually blocks the airway if you've got the head just like it normally would be. So opening up the airway, it's real important, but I can see that it's very difficult to think about, because you think as yourself, well, I can breathe in this position. I just can't breathe in somebody else in that position. So it is called a head tilt, chin lift. And that's the only way you're going to get the breath to go in.
Okay. Another question in the chat here. If you have an AED available, when should it be used?
Okay, so you've got the AED, you can use it immediately. So if you just happen to have one, and you can grab the AED, I can turn it on and it'll just tell you to put the electrodes on. I can do that right away. So you don't need to wait. It's very important to use the AED right away. So I could be doing CPR right up until the minute that it shows up. If somebody is there with me, I can keep doing CPR. They can open it up, turn it on, and just start working around me, putting the electrodes on. You can actually keep touching somebody right up until it says, don't touch the patient, analyzing. So you can, it's hard to mess it up because it has a voice and they'll always tell you what to do.
Okay, that was really good. A good question. I know a lot of times these things can be very intimidating, and there's a lot of fear behind what if I do something wrong or hurt someone. And you touched on it earlier, the fear of, am I going to get sued if I try to help someone? So it's good to know that there are laws in place there, and that we have all these things to help. So another question is, how often do you stop CPR to check for signs of life, or do you stop at all?
Well, you can, if you really want to stop and see if there's signs of life, you can do about 2 minutes or 5 cycles of care. But they don't want you to stop very often because it really is supposed to be obvious to me, with the moaning, coughing, moving. So not often. They would like for you to keep going. So every 5 cycles, if you think about it, you can stop, but not very long. You don't. And if you're using an AED, it'll reanalyze every 2 minutes. So they're all set on a 2-minute timer. And at that point, when it's reanalyzing, you can see then if they're having signs of life. And it'll never let you shock somebody that doesn't need it. So you don't have to worry about anything like that.
Okay. And then another question that I came across as a common question, which, there's a lot of wild questions out there, but can I accidentally kill someone if I give CPR incorrectly?
No. So go ahead and do whatever it is you need to do. No. So I've never heard of any documented case where anybody did anything where it actually made it worse. So they would, like you said, I said before, it's better for you to do it on somebody that doesn't need it than to do it on somebody that doesn't. Anything that we do, like the rib fracture, that could happen. You may feel it, the crunching, or hear it. It's possible, but it's always something that can be fixed later.
Okay. I want to talk a little bit about CPR certification. I know Andrea mentioned that there are a lot of employers that do not require CPR certification. So for those who may be interested in doing that on their own, can you talk a little bit about what the class looks like, maybe how long it is, how good your certification is for, and when you would have to renew, and kind of what that looks like?
Okay, so a regular, just a normal person that would take a CPR class that wants to be certified. American Heart Association offers the Heart Saver CPR training. So we go over adult, an infant, and a child. And we do use the AED as well too. We go over what to do if somebody's choking, so that you know what to do with that. And then we practice everything with the mannequins and with an AED that is just a trainer, so it doesn't really shock, but it lets you at least go through the motions. And we practice on the mannequins doing chest compressions and giving breath, so they can actually simulate the whole thing, even on the infant as well too. The class takes, it just depends on the size, but it's a video-based training. So you watch a video, you practice with your mannequin along with the video. And it takes about 2 hours. It just depends on the size of the group, you know, how many people are in it and how many mannequins are offered. I like to just use 1 mannequin per person, so it can go a little bit quicker. But the certification is valid for 2 years.
Okay, that's awesome. And are classes still being done now with everything going on with COVID, or is it kind of something that maybe is being pushed back only for certain individuals? Does that make sense? Like if I'm just a normal person who wants to do it, would I have to wait to take the class because of COVID?
No. Yeah, no. So I still offer them. Some places are not offering classes right now, but it's my business, so I still offer them. My class size is a lot smaller, so you know, you maybe depending on the size you have, you know, it's hard to social distance. So usually I have 4 or less students in my classrooms. And so and they have their own mannequins. We are using the Clorox wipes. We have hand sanitizer and gloves available as well too. So most people don't share. They don't share the supplies except for the AED, and we wipe that down for the next person uses it. So, and we're all wearing masks during the class too. So that's what we're doing whenever we train at this moment with the COVID going on.
I think that's good to know, because after this presentation, or maybe during the month of February, Heart Health Month, people might say, you know, I've been meaning to take this class now. I just should go ahead and do it. And so COVID is not going to be holding anybody back from taking these classes. You can still take the classes if you're interested. Okay. So that was actually all of the questions that I had. Did anyone else today have any questions? I know we had 2 great questions from the chat so far, but if anybody else has any questions, go ahead and add those in now, please. And then if not, I always like to ask our guest speakers if you could give one takeaway from this presentation, or one thing that you would want people to leave here today with, what would that message be?
Well, it would be, don't be afraid to do something, you know, so, and of course, if you're not sure and you really want to learn, you can always take a class, but yes, so just don't be afraid to do something. Anything you do is going to help the person than not doing anything at all. So don't be afraid. And a lot of people are scared, but it is scary. I get it, but yeah, just try not to be afraid when you're helping somebody.
Marlene.
Thank you.
Oh, that's okay. Marlene, I have 2 questions.
Okay.
Okay. If someone is uncomfortable doing a class at this point, isn't there a tool out there called CPR Anytime, that a kit where you can do it at home and train your family members?
You're right, there is. So it's not a certification, but still, if you just want to know it, it's like a blow up doll and it comes with a video, and you do it along with the video. So you pop it in your DVD player, and then you do chest compressions. And I really believe you can even give breath to those dolls. It comes in a box. Yes.
And then my second question is if an office wanted to purchase an AED, is there a source for that you would recommend? And do you know the approximate cost?
I do, and this is just my personal preference. I found a place that has a lot to choose from. It's called aedsuperstore.com. There are so many choices out there, and you can probably find an AED on there for about $1,000, and some are over $2,000. But it's a good guide, and it's very difficult from then when you get to that page to know which one to buy. So you got to start doing your research, and they're all good, but they're all just a little bit different. So it depends on, you know, how many bells and whistles you want, or if you just want it to be real basic, but they can be really expensive.
Okay, thank you.
Okay, great questions today. I'm going to go ahead and turn the floor back over to Andrea, but thank you for this wonderful presentation.
Thank you.
Yes. So can you guys hear me okay? I'm unmuted. Okay, good. So if you feel like you've watched this presentation and you still have questions, you can feel free to ask the questions to healtheducator@thewomensfund.org. And if you have questions for Marlene, you can also pass those to Health Educator and we will pass it on to her. But I highly do recommend that, this is a class that could potentially make you a hero in someone's life. No one anticipates an emergency, but if you're equipped and you're ready to go, again, I think the first thing we think of in emergency is complete panic, but you can, in those precious moments, you really do have the opportunity to save someone's life. So I highly recommend taking the class, just so you can know, just anywhere that you are, you're equipped to do it. If you're in an airport, if you're, at the grocery store, emergencies can happen anywhere. So with that being said, you can also take this quick survey for us. It should be about a minute or two long. I would say I would put the actual link in the chat, but then I'd have to get out of this this presentation. But you can wave your camera over this QR code. It'll take you straight there. These surveys really help our program team to make our presentations better. Every kind of feedback is greatly appreciated, so we can make these presentations in turn better for you. And then these are some of the events that are coming up. We are still observing and honoring Heart Health Month. And so we have our topics that we've hand selected to help, reiterate that heart health theme. So we have eating disorders, we have heart health with Kayla that we do, and then we have another doctor coming in, I believe from Kelsey, to do another heart health presentation. And we're also doing body image. And all of these things can be found on our website. So you can see when the more dates are, when the times are, and you can, free of charge to you.